What's up, guys? John here, Titan Talk Tuesday. Glad to have you. It's an awesome week, special week for me. I know it's a big Pisces month, man. I'm a Pisces, so it's my birthday, the 23rd, and I know a couple people's birthdays. It was this week, last week. So big shout out to all you Pisces out there. We rule. Sorry, I just had to get a little bias there. What's up, guys? How you guys doing? Nice to see you guys all joining in. If you're asking who this lovely character is next to me right here, this is our advanced registered nurse practitioner, Schaneal.
Hello, everyone.
And Schaneal was gracious enough because Schaneal gets slammed around today. You know, she gets slammed around every day. I mean, patients, she sees a lot of patients during the day. She's answered all the medical questions in here. Schaneal is here every day. She's a medical professional with a medical license and a DEA license and all that. So she sees a lot of different patients. And, you know, she knows all the therapies. Very impressive. We will come back to Schaneal. I want to cover all the events and stuff like that. So I'm just going to go through all this. If you want to chime in, you're more than welcome.
Sounds good.
All right. Because Schaneal does go out to the events. Her and her husband, Matt, they always come out. They always support. They always get their Titan gear. They live the lifestyle. So it's really, really cool. All right. So let's go to it. She is great, Dave. All right. So let's go to the events that are going on. We've got a lot of events coming up, especially in the local area. We're really dominating the market around here and nationwide, but especially in Tampa. And we should. It's our home base. We love our patients, and they are family to us. So if you guys want to come out to the event and see the Titanettes, see me, Tsikouris, maybe Schaneal will be there. We'll have the video out there, get some pictures and all that. You can share it to your social media. For no further ado, the first event two events on the first upcoming, I guess, big event day is April 7th. So April 7th is going to be a big day for Titan Medical Center. All right. So we've got the Titan Classic, which is really cool.
You guys have to come out and see us for that. That's going to be awesome.
Titan Classic is going to be really, really cool. This is the first show of the year that we're doing as far as sponsoring and everything like that. PCA, my man Ian Harrison, Kevin Taylor, they're putting this all on. So it's really, really cool. It's just, you know, classic stuff. It's going to be one day, really awesome. Now, this is going to be going on, and we have Festivals of Speed on the exact same day. We are the media sponsors for Festival of Speed. We have the exclusive HRT and anti-aging clinic of Festivals of Speed in those areas of Orlando and here in St. Pete. And, you know, we basically, we go right along with them because they do a lot of luxury brands like Lamborghini, Ferrari, all those upper brands, Cartier and all that. So, I mean, Titan is that, you know. We don't want to be at that price level all the time per se, but we want to deliver that type of service and that type of standard for our patients. So that's really cool. So we got a lot of questions. All right. I'm in the frozen wasteland, man. I'm sorry for you, Steph. Florida is pretty warm right now. It's actually, I think it's hit some record highs or close around record highs.
80 lately, 70.
I know. It's beautiful
weather.
It's beautiful, you know, and that will come back to another thing we're going to talk about, the sunlight and vitamin D. It's our therapy of the week, and Schaneal's going to break it down for you a little bit, and I'll talk about it, and then we'll answer your questions and stuff like that. So please, guys, share this real quick because we're going to get some good information. You've got a medical professional live on here. We can talk about a lot of different things that you're not going to hear. We're going to give you some insight about some different things. Oh, wow. Ireland. Yeah, we do need to get in Ireland. First, we're trying to hit Canada. Okay, so April 7th, Titan Classic, Festival of Speed. We will be there. Europa is the next weekend. So if you're in Orlando, we will have a 20x10 booth right when you come in. We will be dominating that. We've got a lot of Titans coming from around the country and even maybe possibly around the world. So I might be bringing in some special guests from out of this country and in this country and bring them down here and see what's going on. I know I've got a couple special guests already in line and they're already booked. So you're going to have to come out to the booth and wait to see who it is, or we'll be promoting it probably the week before. So that's another huge event. We've got Iron Bay Classic, we're title sponsor this year. Seminole Classic, or not Seminole Classic, but it's another one that he's doing. I don't even know what the name of it is because it's going to be the first year the show's going on. But we got a lot of different shows going on with him. Dennis Warner, at that point, we're doing his shows, title sponsored. I'm really proud with that. All the PCA shows. So we got PCA Miami, I think PCA Midland, Florida. We've got the USA Championships. That's going to be awesome. A lot of great events, and that's just for competitors and stuff like that. Now, we don't just service competitors. We service everybody. nationwide, so the regular average day Joe is usually our patient. It's not, we do get a little bit of competitors through, but the majority of the people just want to feel good. They want to be healthy. You know, the amount of time they have, either, you know, not just having to sleep or feel groggy or crummy or just not good, you know? No energy, and have to take something else to just really spice your energy levels up. Not cool, not cool. All right, so we've got that. We'll be hitting the crunches, you know, around the area. If you're in Tampa, please reach out. Stop in there, say hi to the Titanettes, fill out your name on the database, get a free t-shirt. That's awesome. I think that's it. So what do we do at Titan Medical Center before I start getting in with Schaneal? So at Titan Medical Center, we are a real medical center with real medical doctors and real medical practitioners. We service everybody nationwide in bioidentical hormone replacement therapy for males and females, medical weight loss, vitamin amino acid injectable therapies, rejuvenation detox, libido enhancers, and a lot more. So whatever you're trying to accomplish, feel better, look better, perform better in any of those aspects, we can help you get to that level or help you as fast as possible expedite those results, okay? You are ultimately the one it's going to fall back on because we can give you the tools, but you got to use those tools to get where you want to go, okay? All right, so we're going to talk about some different things today. We're going to talk about, obviously, vitamin D, and we want to talk about deficiency of vitamin D and how important vitamin D is. I've been really just trying to stress this on people. The reason is I'm a prime example. I go out in the sun, I've got like golden brown skin or whatever, or lose a tan. So I know I'm getting efficient sunlight. I know I'm getting the ultraviolet rays, but my body's not converting the vitamin D in my body, which some people have a problem or issue with doing, right?
Absolutely.
So at that point, I came back deficient. I came back in like the low range of normal on a LabCorp test is 39. I came back in a 29. That's pretty bad. And I haven't came back that low ever. And I know that, you know, vitamin D and low vitamin D is a direct impact on a lot of different things. So don't hear from me. Let's hear from a medical professional. Because, you know, I can only talk so much, guys, but I have to learn from them and everybody else that's medically professional and medically certified to do this. So whenever you talk to somebody at Titan, I just want to throw this out there. A free consultation. What does a free consultation mean? So a free consultation, you can talk to me free all day. You can talk to any of the medical assistants all day for free. But are you going to talk to a doctor, PA, or a nurse practitioner for free? Well, I'm going to give you some for free right now. All right. So vitamin D, what do you think about it? What do you know about it?
Yes.
Let me hear from you.
So vitamin D plays a lot of important roles in our body. Some people say that it can help, you know, combat depression, high blood pressure, high cholesterol, all those little things, which may still be under debate a little bit depending on which studies you read. But most importantly, it does help with calcium absorption in the bone. And it also helps prevent parathyroid hormone release within the body, which causes bone resorption over time. So if you have a vitamin D deficiency, that can lead to osteomalacia, which is a softening of the bone. Can also lead to osteoporosis and osteopenia over time, which is a decrease in the bone density, which can lead to fractures, falls, weakness, you know, joint bone pain, that kind of thing. So it is really important to make sure that those levels stay optimized. As you said, patients with darker skin complexions and things like that do not have as easy or readily availability to absorb and convert that vitamin D that is appropriate. Some things other people don't realize that can cause decreases in vitamin D absorption is obesity, for one. Studies have shown that patients who are over a BMI of 30 tend to have a decreased absorption of vitamin D. That reason being that it is a fat-soluble vitamin. It is stored in the liver and fat stores. So if you do have a higher fat concentration, thank you, it can cause that to hold on to the vitamin D and not be readily available for the body.
That makes sense.
Also, the time of the year. We just went through winter months here, especially some of you where it's still cold up there, not getting out in the sun. So, like you said, not getting adequate sunlight can also play a role. Aging can also cause a decrease. Certain conditions such as kidney and liver disease, because those do have proteins in kidney and liver that can help your body convert vitamin D into its active form in your body. So any one of those can cause you to have vitamin D deficiency. So a lot of people don't recognize that and think it is just a sunlight type thing. So if you are having symptoms of fatigue, you know, weakness, depression, any of those things, which can be non-specific, so please don't go to Dr. Google and say I have vitamin D deficiency and start popping vitamin D pills like they're candy. Which brings me to another point. You don't want to diagnose and self-prescribe vitamin D over the counter in high quantities. It is fat soluble, so it can build in your system and actually be toxic to your body if you have too much of it.
Gotcha.
So with that being said, it can cause high calcium levels and things like that if you're not careful.
Gotcha.
So.
Yeah, I know. Another thing is that I bring up all the time is that because it goes along with our vitamin injectables, is that usually people get another source of vitamin D from enriched foods, right?
Yeah.
So at that point, like, what is your diet looking like these days? Because mine's not. I mean, I'm probably not getting a lot. Obviously, I'm not getting a lot from my diet. I tried an oral supplement to do it. I'm gonna blood test and see. It came back kind of low still on the oral supplement. I did start my injectable 50,000 I use, and I gave the instruction video on how to do it.
Perfect.
Yeah, so I think that's a big one to play because not a lot of people talk about it. Vitamin D is not really a vitamin; it's a hormone.
Yes.
So, I know that's like a common thing. People are like, why it's called vitamin D? It's a hormone. But it is. I don't know what to say. Just like melatonin. I mean, it is too. So, all right. So that's our therapy of the week, vitamin D, and we want to make sure that you guys were all like just aware of it and just just in the back of your mind because you can get it tested through Titan, $25 for a blood test for vitamin D, or add it onto the panel, the full panel if you want. If you can try to do it through your general practitioner and see, hey, listen, can you test my vitamin D? And just always see where it's at. It never hurts to check and monitor where you're at, right? Because you can always tweak and test and tune and go from there. At least you know and not knowing and just keep going down that path and hurting yourself. So that's what it's all about. I would love a free consultation. Are you in Chicago? All right, so we just talked about the free consultation. So the free consultation, you can call and talk to us and we'll consult all day long. When you start talking to the medical providers or the doctors, it's going to cost them money, right? Unfortunately, they're not free. I hate to say it, but it is. It's true. So I got to make sure that I pay them adequately, and I got to make sure that we are continuing on with patients that need it because we have a ton of patients, and she sees a ton of follow-up patients, ton of new patients. In vitamin amino acid injectable therapies, I know you know a lot of them. I know you've tried some of them.
Most of them.
Most of them. So she's like me. Schaneal is definitely. She likes to be she likes to test it and see for herself exactly what these therapies are going to do, how she feels on them. And then, it gives her more of an insight to when she talks to patients.
Absolutely.
Because she knows how that injection is going to go, what she's going to feel, what she went through, how much it affected her. Instead of going to somebody and them telling you should take this, this, and this. Well, have you taken this before? And probably they're going to say no. And if they say yes, they're like, okay, well, what'd you see from it? And they should be able to tell you their experience. But what do you think is the best vitamin amino acid injectable we have?
Oh my gosh, I have to choose one.
Choose one for. I mean, I guess Titan Complete would be another way. My favorite, I guess.
Yes.
And I would have to.
Nectar of the Gods is great also. Glutathione.
I guess it's just what you're trying to aim for, right?
Exactly. We have a plethora of therapies here, something for everyone.
Yeah.
But just since you brought up Titan Complete, we can certainly go over that.
Sure.
So that is a great just all-around therapy. It can be suitable for anyone, really. That one's going to have your B complex vitamins. So it's got your B1, 2, 3, 5, 6, and 12. That's going to help with natural energy levels, lowering inflammation in your body, red blood cell production, can also help with stabilizing cholesterol levels, help with digestion, healthy skin, hair, nails. The list goes on and on. The B vitamins are fabulous.
Yeah, we need them, right?
We've also got your branched chain amino acids in there. So you've got your leucine, isoleucine, and valine. So that's going to help with your muscle and tissue recovery after your workouts and exercise.
Mm-hmm.
And then for all those patients who want to lose fat and help with weight loss, which is probably the majority of us out there, you have your methionine, inositol, choline, and L-carnitine in there to help your body utilize fat and cholesterols as a source for energy and help with that weight loss.
Dude, that's awesome. So, I mean, it's really packed. It's got a lot of different things in it. Don't let other places or, when you look at things, throw the shade over you. Because I always talk to patients on the phone, right? And I kind of tell them what we have Titan Complete. Like, oh, I tried something like that with Lipo C. Guys, when you're getting like Lipo or Lipo C or any kind of medication, it'll tell you the ingredients, the active ingredients are in the bottle. And when you're looking at something like that, you're talking about 3 or 4 to like maybe 7, 8, 9. Just all depends what blend you do. Maybe 4 in some of ours, like Titan Ultra. That's another big one. But I mean, that's it. I mean, so peptide wise, we're gonna talk about a new one today. And I asked you about it. So, and we'll go on about some libido enhancers, stuff like that, maybe some other peptides. But the big one we want to bring up, because we're gonna roll this out and launch it, would be Thymosin Alpha 1.
Yep.
All right. So I've read a lot about Thymosin Alpha 1. I know it's an immune system booster, modulator. I know that it's awesome. I know it was FDA approved. So that was cool.
Fantastic.
Yeah, so we like FDA
Gotta
approved.
love that, yes.
All right, so so what do you think about Thymosin Alpha 1? What do you know about Thymosin Alpha 1? How do
I'm
you think
so
it's gonna help?
excited about this therapy. So Thymosin Alpha 1 comes, of course, from the thymus, which is, for those of you who are nerds like me and like to know where things are in your body, it is behind the sternum, between your lungs, in that area of your body. Thymosin Alpha 1 comes from the thymus, and it plays a key role in augmenting T cell function as well as dendritic function. So what that's going to do, you have helper T cells and natural killer T cells. Those are going to help identify and attack any foreign bacteria, antiviral infections, those kinds of things, colds, you name it, cancers in some instances. It's going to help identify those and help your body function more optimally to attack and go against those cells that are harmful to you. So it is really good to help boost the immune system. There's also some studies out showing that it can be helpful in anti-inflammatory conditions like rheumatoid arthritis, psoriatic arthritis, lupus.
Wow.
So a lot of really great studies for that. I'm really excited for us to get that on board and be able to.
I'm excited too. I know we've talked about it a while. So, you know, we get to this list from the pharmacy of kind of what they're producing, and we kind of look at it from our perspective for our patients and stuff, and what's going to benefit them the most, you know, what has the less risk and stuff. And Thymosin Alpha 1 it's a winner all the way around, you know. I mean,
very good safety profile as well.
So, I mean, that's great. So, I mean, if you guys don't know about Thymosin Alpha 1, you guys can look it up. I implore you to do so. And then contact Titan Medical Center and set up your appointment. We can help you out nationwide. All you have to do for this peptide therapy is fill out the new patient paperwork, right? You see the medical provider. You might see Schaneal. And at that point, she can go over these things with you personally and then recommend what's best for you. And this would be a pretty good one for about everybody. I think with the flu, too, that went around, I mean, I hear from everybody, man, that flu really knocked me in my butt for 2 weeks.
It did.
You know?
I had it.
Luckily, I might have had it for a couple of days because I was sick for a couple of days. But I take glutathione usually once or twice a day to build my immune system or to help me as much as possible.
And that was when I got it, was when I stopped taking my glutathione for a couple of weeks. And then I had my husband pump me full of it, and I got better in a couple of days. But,
it's great.
Yep, it's great therapy.
I think, you know, mixing those two would be a good one. So, guys, Thymosin Alpha 1, that's going to be our new therapy coming out. Now, guys, we only service in the United States right now currently. We will be hopefully opening up soon. Now, if you're in a different country, right, and you know somebody that wants to bring a Titan Medical Center to your country, we can franchise to your country. That's not a problem. We just don't have anybody there yet. So, at that point, put your inquiries in. You can always email or text, whatever you like to do. Check out Thymosin Alpha 1. Now, it's not Thymosin Beta 4. Excuse me. TB500 is what the name is, by Thymosin Beta 4. Thank you. At that point, so don't get the two mixed up. But probably the two together might be a great mix too.
Absolutely.
I mean, if you're using both. And I know they both originate from the thymus gland. All right. So, yeah, that's really, really cool. Another one is BPC 157, guys. I always talk about it. Yes, Corey, you can definitely get some help. All you got to do is just call or text. Eric, what's up, man? How you doing? All right, so BPC 157. So BPC 157 is another great peptide, and the reason I bring it up is because I've used it personally. It's helped me through some great injuries, shoulder injuries, tennis elbow, golf elbow. So at that point, like, I really, really am passionate about it. The things that I've really used and I've known have worked for me, I'd like to pass on the information. BPC 157.
Absolutely. That is, first of all, just a great therapy all around. Like you said, it does help boost collagen factors to help support fibrous tissues like your tendons, ligaments. Also has some regenerative processes in bone. Can also promote angiogenesis to help with promoting new blood vessels and blood flow to help optimize healing to that area, as well as lower inflammation. One of the key things with that therapy, though, that a lot of people don't realize is that it also has a lot of gastroprotective effects. So patients that do have Crohn's, ulcerative colitis, acid reflux, things like that, are now starting to try and utilize that therapy more and more because of those GI protective benefits that it has. And it does have a really good synergistic effect with TB 500 or the thymosin beta 4 like John was just talking about. So if you're going to heal an injury, I would recommend using them both together.
Yeah, you know, and we talk about these peptides, you know, before we didn't have these awesome peptides, right? We didn't have these clinical studies and stuff like that behind it. Now we have this stuff. I heard, you know, somebody came on one of our comments, and you know, it's just unclassic, I guess, but it was from some other clinic, and he goes, "Oh, peptides suck. They're garbage. They don't work." I'm like, I mean, obviously they work, right? So at that point, and you should just take growth hormone, guys. Growth hormone is not for everybody. All right, I know it's this, you know, supposed wonder drug for anti-aging and everything like that. It's highly regulated. It's looked down upon. That's why you don't see doctors prescribing it left or right, because they know their license is going to be in jeopardy if the DEA or anybody starts looking at them. So at that point, it's really expensive as well. All right, real growth hormone is really expensive, and it can do some negative effects.
Shut down the pituitary gland and
cancer. I mean, so it's not going to give you cancer per se, but it will expedite, you know, the growth of cancer cells.
It stimulates cell tissue, and it's non-specific to what it stimulates. So God forbid you have tumor cancers, it will accelerate that growth as well, like you said. So
yeah, so I mean, there's a lot of different things that are more safety-wise. The safety profiles of these peptides are a lot better than growth hormone. It's a lot cheaper, right? People complain about price and stuff like that. So one of most bang for the buck at the least price. So this is kind of where you're going to get that. GHRHs, growth hormone releasing hormones. We get questions about it all the time. And because we talked about growth hormone, guys, don't fall for the growth hormone thing all the time. Don't shut down your pituitary, especially if you're young.
Absolutely, yes.
I've seen people come like over from clinics like 21, 22 years old. People put them on growth hormone. Guys, you should not be on growth hormone at 22 years old. I'm sorry. You know, unless you're trying to do something crazy or bodybuild and Mr. Olympia or something like that, guys, you guys got to watch out for that stuff. Don't shut down your natural function if you don't have to. Use your function, blood test, see where you're at. If you need to replace and go optimize and do that. But that's really, really important. Yeah, I think we covered pretty much about it on Titan Talk. Is there anything you want to bring up, Schaneal?
Just that I'm happy to be here, and thanks for listening to me.
We'd love to have Schaneal on. So we're going to try to have Schaneal on or do more educational videos in the future. I just got to carve out some time in her schedule because she's seeing so many patients. Or she's prepping charts or whatever she does. Schaneal's awesome. So if you guys want to set up appointments, it's real simple, real easy. All you have to do is call or text 727-389-3220. And we can set you up with appointments nationwide. We can blood test nationwide for you. Now, all the vitamin amino acid injectable therapies and most of the peptides do not need blood work. All you have to do is fill out the new patient paperwork. You'll see the medical provider, and after that, you can get your recommended therapy packages. It's very simple, very easy. We are here for you. Health is number one priority to us, right?
Absolutely.
Number one priority.
Absolutely.
I mean, even Schaneal, some of you guys are patients that are probably on here. You guys have probably had visits with Schaneal, and you know how thorough she is, especially about your health and especially about your vital organs. All right, do we have anything up here that we should cover? Special thanks to, of course, Schaneal. We got a giveaway. That's right. We don't want to get off without doing the giveaway. So we got 2 giveaways coming up. One is for Titan gear. I've got all kinds of exclusive Titan gear. I know you guys must have seen the jumpsuits. A lot of you guys have. They're getting embroidered right now. I didn't have size for everybody. I didn't expect it to be like that. So everybody just jumped on it and exploded. So I've got more getting made, but it's going to take me a couple weeks. All right, so don't say that one. But I have exclusive Titan leggings, tank tops, V-necks, all kinds of stuff. Nike sleeveless for guys out there up to like 2X. So here's what you got to do. You have to text the number 727-389-3220. That's our main number. And you're going to text #Titan Gear. Right?
It's really comfortable, guys. You want that gear, trust me.
Trust me. You guys know it's only the best. First class clothing for first class patients receiving first class therapies. All right, so Hashtag Titan Gear. 727-389-3220. They will be getting those text messages and they will be going. All right. Here's for the $100 gift certificate. You can use this gift certificate at anything that Titan does. So whatever we do, you guys can use this gift certificate. Hashtag Titan Gift. 727-389-3220. Guys, if you have not subscribed to our YouTube channel, go there now and subscribe to, please, or after the video. I've seen another video of Hercules Potion. 1 million views.
Really?
We have an instructional video with 3.1 million views, and now we have Hercules Potion with 1 million views. Wow. Thank you, guys. For real, that's huge.
It is a great therapy.
It's huge. I mean, I have that many people talking about Hercules Potion on the internet. Wow. You guys, it's crazy out there. All right, so I think that's about it, guys. I love you guys. I appreciate you guys tuning in. If there's any comments or you guys want us to answer any questions on the next Titan Talk, please get them in. DM us, text us, let us know, and we'll kind of put them on the list, and we'll answer them next time for you guys. And then Schaneal will carve in another spot. I'll let you guys know more than one day in advance next time. And if you haven't known, the Ultimate Health Bible, me and Jeff Bahar, go get your copy. Awesome information in here. It's going to help you. I don't care if you're an amateur or you're a seasoned vet. I promise you we'll learn something. All right? Amazon, Kindle, Barnes & Nobles. Grab your copy. If you send me a receipt, I'll give you 25 credit either towards your therapy or towards some free Titan gear, whatever you want. All right, guys?
All right. Thank you.
Thank you guys for tuning in. Keep it locked to our social media, Instagram, Facebook, Twitter. We will be coming at you with all kinds of content. And watch out for this summer because water here in Tampa, we're going to be taking over again. And we got a lot of surprises for you coming.